presentation, severe combined immunodeficiency disorder, bubble boy disease. رانيا إيهاب and أمنيه حسام. Would you please introduce yourself?
Hello everyone, I'm Rania Ehab, a student at third year Biotechnology Cairo University, and this is my partner Umnaya Husab. Today we are going to talk about bubble boy disease. In 2001, the bubble boy disease. In 2001, a movie was released. It was talking about a boy who lives his life inside a bubble. But do you think, is it real or it is just a movie? Actually, it is not just a movie. The bubble boy is real. He is David Vetter. David was a child born in 1971. He was suffering from severe combined immunodeficiency, which forced him to live his life inside a sterile chamber to avoid any bacterial or viral infection. But usually the babies with severe combined immunodeficiency die within 1 year. But as you see here, David is more than 1 year and he looks good. This is because he was added inside this sterile chamber. But he starts to grow up and he wants to go out, he wants to interact with people. So they added him inside a space suit which to interact easily with people. David was the first one who was put inside the bone marrow transplantation, but unfortunately he died. But unfortunately he died at the age of 12 years old due to a viral infection which led to his death. Severe combined immunodeficiency is a primary immune deficiency. But what is the difference between the primary immune deficiency and the secondary? Actually, the secondary is acquired while the primary is genetically inherited. Severe combined the primary immune deficiency has 3 categories. The first one is T-cell lymphocytic defect. The second one is the B-cell lymphocytic defect, while the third one is the combined case in which there is a defect inside the T cells and the B cells. So in some cases there is a defect in the natural killer cells. Okay, so this disease is fatal in 1 year. Usually babies with severe combined immunodeficiency appears normal until the age of 3 months. Appear normal until the age of 3 months as they still have their mother antibody. But once this antibody is depleted, the infection is stopped. There are 3 kinds of infection: the viral infection and the fungal infection and the bacterial infection, which cause a lot of symptoms. As failure to thrive, which means that there is abnormalities in the graft. In this graph, the x-axis shows the age of the child, while the y-axis shows the length or the weight. This curve indicates the growth of the child. But if deviation occurs, this means that there is a defect, and this is an alarm for being diseased. And oral candidiasis, which is a fungal infection, which have thrush in their mouth, and diarrhea, rash, bronchitis, which means that there is alveoli filled with pus, and pneumonia, otitis media, which means that there is inflammation in the middle ear cavity. This inflammation causes loss of hearing and liver abscess, which means that they have liver which is filled with the pus, and multiple rash. Then what we can see under the microscope, the morphological symptoms as hypoplastic lymphoid tissue. The organs which is responsible for producing the lymphocytes at the bone marrow and thymus are depleted. They cannot produce any lymphocytes. This is the thymus, and this is the histology of the thymus. Here you can see the capsule, and then the cortex and the medulla. Here, which form the lobule. This lobule, this is the lobule. Okay, this is the green. The blue part is the cortex, while the green part is the medulla. In between, there is 40 medullary junction. This is the thymocyte. Okay, this is the thymocyte, which will be matured into the T lymphocyte. But in this case, the thymocytes and the T lymphocytes are not present. And in the chest X-ray, there is absence of the thymic shadow. As we see here, the thymic shadow is not present. Types of SCID. There are two types. The first one is autosomal recessive SCID as adenosine diamynase, which is second most common. Then the X-linked recessive SCID, which is the most common, which occurs due to deficiency in the X chromosome, which led to this disease. In the X-linked, there are latent T cells and natural killer cells, but the B cells are still count normal. Since the defect in the X chromosome, so it occurs in males only, as they inherit the defective gene from their mother. The defect here is due to genetic mutation in the gene called IL2RG, which is present in XQ13.1. This is the gene. Okay. The IL2RG gene is responsible for production of common gamma chain protein. This protein is the common subunit of the receptors, which will be bind to the interleukins. But if this protein is not expressed, so this receptor is not functional, so it cannot be bind into the interleukins. There are 7 types of the interleukins, but the most important is IL-7 and IL-15. IL-7 is responsible for differentiation of the T cells, while IL-15 is responsible for differentiation of natural killer cells. Here you can see this is the bone marrow, which is responsible for which contain the stem cells. These stem cells will develop into common lymphoid progenitors, which will form the pro-B cells inside the bone marrow and the T cells inside the thymus. But here the photo is not appearing. Okay. Then these cells will be matured into mature T cell, but this process is blocked now as there is no common gamma chain protein. Then we're going to talk about the treatment. My partner Umayya is going to talk about it.
Thank you. Now we are going to discuss the treatment for SCID. But first I want you to keep in mind, and earlier what she said, that the X-linked SCID is a genetically inherited disease. So we have a case where there is a mutation in the gene. The first thing we're going to talk about is probably the most common, which is bone marrow transplantation. Bone marrow transplantation has a successful rate ranging from 60 to 90%. It's also very preferable to be performed in the very first 3 months of life. In the bone marrow transplantation, in the SCID patients, they do not have the luxury of having 100% matching donor. So they usually turn to the haploidentical technique, which is finding maybe 50% matching donor. And this is what happened in David's case earlier. David had a sister who was healthy. Her name was Catherine, and she was the haploidentical donor. When he got the treatment at the age of 12, there was not earlier developed as haploidentical techniques. So this requires the depletion of the T cells of his sister's bone marrow to avoid diseases like the graft versus host disease. But unfortunately, David died at the age of 12 after the performance of this procedure because there was an undetected or unscreened virus in his sister's bone marrow. Some other techniques are being developed, such as the uteral BMT, which is done inside the mother's uterus on the fetus, because scientists believe that it's a sterilized environment and we can improve the immune system before the kid is born. The complications that may develop from unscreened or undetected viruses or other infections is very serious and very risky, because so many patients have undergone bone marrow transplantation for SCID, whether it was X-linked or ADA, which is a very common type as well, and they have died afterwards because so many infections and complications arise afterwards. Also, they have found a problem afterwards that even though the mutation is still in there, but the T cells are functioning properly, but the B cells are still not working. So patients are required to take something called a gamma globulin for the rest of their lives. These risks and disadvantages have led them to develop this very next treatment, the second one, gene therapy. Now, gene therapy is basically a simple idea in SCID patients. They take the white blood cells from the patient, insert a retrovirus that has the correct form of the gene, and then inserting them back into the patient's blood. And it has been recorded very successful in returning the immune system functionality in 17 children. And the most common, the most famous person who undergo gene therapy was a woman called Ashanti De Silva. In 1990, she was the first human to be treated with gene therapy. She was only 4 years old and she had ADA SCID. Until the moment we speak now, Ashanti is very healthy and alive, and she has a very functioning immune system. So this shows us that gene therapy has made a revolution, because earlier, before even bone marrow transplantation, SCID patients had no hope of living. Whenever a child was born, he was sentenced to death because it was either the bubble, and it wasn't very available to many kids, or either they died. However, the gene therapy has its risk, because in 2000, a study was done on approximately 10 patients who received gene therapy for SCID. Afterwards, in 2007, they started developing leukemia. 4 of them developed leukemia. It was later explained that the retrovirus landed near an oncogene on the genome and started expressing it. Furthermore, they decided to do modifications on the gene therapy using zinc finger nucleases. This is a diagram shows how gene therapy is done. They just simply take the white blood cells, alter it with the gene, and then reinsert it. This makes a very promising treatment and the most successful one. And also, it is very ethical, because when we look back on David's case, I think what happened to him was very unfair. Because David had an earlier sibling who died of SCID, and scientists convinced his mother that she should have another child so they can make experiments on him. They promised her that he would be okay and he would be treated, but he died at the age of 12 without any hope of living, or they didn't even find the cure. Okay, science does not stop there at gene therapy. No, it promises us even more. Future plans for immunodeficient diseases, not just SCID, are being clear. Now, the researchers at the Marriott Center for Allergy Immunology in Yokohama, Japan, have made something very spectacular. They tried to create an artificial lymph node. Namely, a natural lymph node in our body is an oval-shaped organ which is strategically spread all over our body to detect pathogens that cause infection and produce T cells and B cells that produce antibodies, and then we can fight infections with our body. What they did and how they created these artificial lymph nodes is that they brought a 2 to 3 millimeter of collagen protein, a scaffold protein. They injected it with stromal cells and dendritic cells. And both cells are very important. Stromal cells are found in our connective tissues all over our body, and dendritic cells, they function as they detect the pathogen and start start the B cells to produce antibodies. The experiment went as following. They implanted the artificial lymph nodes in a normal mice, and then they triggered an immune response by injecting them with antigen. A picture of the artificial lymph node, the collagen protein, and this is the picture of the experiment. The normal mice triggered an immune response, and the artificial lymph nodes were filled with B and T cells of specific memory type. Afterwards, they took the artificial lymph nodes and implanted it in two groups of mice. The first was the deficient group. They had no functioning immune system. And the second one were normal mice. The deficient immune mice, however, showed very better results. Here we can see the two lymph nodes were implanted in the upper and the lower region of the kidney of the mice, and each mouse got 4 transplantations. Afterwards, they triggered an immune response in the two groups. The first deficient mice group showed that they earlier marked the cells with the fluorescent dye so they can track. The deficient mice showed that the cells migrated on the immune response to the deficient spleen and bone marrow, and these two organs started producing large quantities of the specific memory type cells. The normal group, however, did not show similar results. After they triggered the immune response, no cells migrated anywhere. They stayed in the artificial lymph node. And afterwards, the results lasted about 4 weeks. So this study had its limitations because it has only been done on mice. This is the first thing. And they haven't been able yet to make something as complex as our artificial lymph node. Even though the synthetic one may work fine on mice, it's not as complex as the real one. So this leads me to the conclusion that I believe, in our opinion, that gene therapy is the best treatment for SCID till now, because in so many cases it has been reported being very successful and restoring the immune system without complications, even though there were few leukemic patients. And of course, the artificial lymph node is just a future plan. So even though it's a future plan, this is what biotechnology promises us. By using these techniques, we can treat afterwards diseases like AIDS, which is HIV, and cancer. Even it can help treating cancer. This is a picture showing the B and the artificial lymph node, and the cells migrating from it going to the spleen and the bone marrow. These are our references. Thank you for listening.
Thank you. Interesting topic. Thank you so much. I would like just to ask you, in what country were gene therapy and artificial lymph node were tested?
The gene therapy was tested in the United States, of course. It was the first person, as I said, who underwent this treatment was Ashanti De Silva. And another girl, a 10-year-old girl, after the therapy.
She was American?
She was American, and she's still alive until now. She had SCID, but she's very healthy, and her immune system is fine. The artificial lymph node, however, is being tested in Japan, in Yokohama City. It has shown very good results.
And which one is more effective?
Effective, I think, until now, is gene therapy, because yes, artificial lymph nodes has only been done on mice. So, but this is very, I think, promising technology. This is a new approach, because it promises us treating so many other disorders when it comes to our immune system. And even though scientists, they went too far, but they said that one day they can change or replace the human immune system with very functioning artificial ones.
Did you read anything about how expensive these treatments?
Well, they are very expensive, of course, but I think afterwards, like 30 years from now, or it becomes cheaper and it becomes more common and more available for people. So this is just in the beginning, yes.
Thank you, very interesting.
Thank you. Any more questions? Thank you.